Hello, everyone. My name is Dr. Muaz. Today we'll be studying psychiatry. We can wait another 5 minutes for everyone to join, and then we'll start our session. In the meanwhile, does anyone has any questions regarding psychiatry that anyone wants to ask? So I could ask to answer any of those questions.
What will be the source for psychiatry, the textbook that we need to concern for psychiatry?
Okay, so for psychiatry, I think first aid is the gold standard, and first aid will cover almost everything from psychiatry. So remember, the main thing about psychiatry is whenever you are starting study psychiatry, it's not just the symptoms or things like in other systems. You need to have a picture of every disease, because every disease is related to a human being. So always think of some person in your life or in a media or anyone, and just imagine if that person is having a disease. For example, we will be studying about narcissistic personality disorder, paranoid personality disorder. So I can think of a lot of people who have a narcissistic personality disorder, right? So when I associate those conditions with a person, they will become very easy. And the second important thing about psychiatry is that in psychiatry, there are a lot of diseases which are very common. So you'll see how paranoid personality disorder is related to schizophrenia, how different classical conditionings, how different defense mechanisms are related to one another. So learn to differentiate between them as you go on, because in the exam in psychiatry it will be very simple. They will just give you a diagnosis of they'll just give you a diagnostic question, and then they are going to ask you what is the problem, and they will just list the 7 or 8 most closest options, and it becomes difficult there to differentiate between those things. And the most important thing regarding psychiatry is that this system is very heavily tested in step 1, step 2, and step 3. It always forms the backbone of your study in step 1, step 2, and step 3. Okay, so this was one thing. So it forms the backbone. And another thing regarding psychiatry, it is such a system that in which you do not need to cram everything. If you just learn it for once and just leave it there, you won't ever forget it. Be it be 1, 2, 3, 4, or 5 years in the future, it will stick with you. So if you do it good in step 1, and you have to eventually give step 2 and step 3, so you won't need to revise it. And in step 2 there are almost 600 to 700 psychiatric questions in the world, I think, something in the range of that. And they become very easy for anyone who has a good base in psychiatry. That is the thing which helped me a lot in first in step 2, because I did not have to prepare for psychiatry, and the questions were very easy for me in the psychiatry, because I tried to give it a good go in step 1. Similarly, I think biostats is another such thing which will help you tremendously in step 2 and step 3 as well, and ethics as well. So try to do these three systems very comprehensive and in a very comprehensively and in a very good way, because I have seen that a lot of students just skip on their psychiatry sessions and the biostats and ethics as well, because students tend to do these sessions or tend to learn these things in the end, and at that time they just want to give their exams, or they are just so tired that they don't give the maximum amount of effort in those things, right? So I would say give your maximum in the psychiatry as well. Can everyone see my screen?
Yes.
Okay. 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 So we'll start first from classical conditioning. Okay. So what is classical conditioning and why is it important? So classical conditioning means that whenever a natural stimulus or a response is given to your body, the body tries to learn that thing. And after that, when so basically, uh, let's take the example of Pavlov. So what is Pavlov? So what did Pavlov did? Does anyone know about Pavlov?
Yes, the classical condition of a dog where when a bell
I'll
is
see the
rung or
screen,
something,
doctor.
he conditioned the dog in which when he heard the sound of the bell, it begins salivating. You know that food is going to be about to receive the food and stuff, so it begins
Okay.
salivating and you know.
Yes.
Screen has not been shared.
Yes,
Yeah, we
Dr.
are not
Moz, your
seeing.
screen is not showing anymore.
Okay.
Not
Okay.
showing
Is it showing
screen.
now?
No.
Is it showing now? Wait. Let me check
No,
again.
No.
no,
No.
doc.
I think it will be showing now, right?
Yes, it is.
Now
Yeah.
he is showing.
Yes.
Okay, so first of all, let's move on to classical conditioning. So, guys, remember what happens in classical conditioning, or what Pavlov did was Pavlov gave us a natural response to our body. So, what is a natural response to a body? So it was salivation in this case. So first of all, he gave us a natural thing, and which was he gave food to the dogs, and whenever he was giving food to the dogs, he rang the bell at the same time. So he combined two things together, right? So he in classical conditioning, what you do is you combined a pre-learned thing with a thing with another thing which is new. So this is known as a classical conditioning case. So what Pavlov did was he knew that dogs will always salivate on food. So this is a pre-learned thing. So the stimulus was a pre-learned thing, and then a natural response came, which was salivation. So he wanted to couple this thing with another thing. So whenever he gave food to the dog, another thing that did was he rang the bell at the same time. So what happens in our brain is our brain associates the bell with salivation as well. So this is a case of classical conditioning. So that is how classical conditioning occurs. So when after some time, so after like 3 or 4 months, he removed the bell. He removed the bell. He removed the food, and he just rang the bell, and the dogs started salivating. So this is a very important class. So this is a very important scenario. And why is this important? Because classical conditioning plays a very important role in different psychological diseases. Like let's take uh, post-traumatic stress disorder, right? So what happened in the post-traumatic stress disorder was that there was a blast, or there was an army soldier who had a blast there, and when there was a blast, he got hit he got his organs injured. So the organs getting injured, or him getting injured, was a natural response to the stimulus that was present. So that stimulus got conditioned with the blast sound, or the visuals of the blast. So now, whenever in the future the person will see a blast, or the sound of a blast, or the visual of a blast, he will relive that experience once more, and the brain will play that thing once more. So that is how they can ask you this question in the exam. So this is a case of classical conditioning, right? So another example of classical conditioning could be, for example, you wake up every day so normally we wake up every day in the morning, and it's a normal thing for us. But what if I say that whenever you wake up in the morning, you have to go to the hospital at 4? So that is a traumatic experience, right? So waking up and going to the hospital at 4. So that traumatic experience gets conditioned with waking up early in the morning. So Now on Sunday, if you wake up at 4, you will not feel good. You will feel some kind of a trauma as well. So that is how classical conditioning plays an important role. Then let's move on to operant conditioning. So first, we can skip operant conditioning and transference for now, and let's move on to an important topic. So the most important topic in psychiatry, I think, and they love to talk about this topic whenever this is a very important topic in NBMEs as well. So it is the ego defense. So what are ego defenses? So ego defenses are the thoughts or behavior. So all of us have a lot of problems in our life, right? So whenever we face a conflict or a difficult condition, our brain makes up some defenses or some mechanisms to get us resolved of that problem or to give us a peace or a relief. So the ways or methods by which our brain gets us relieved or those tensions or the conflicts are known as the ego defenses. So what's important in those ego defenses is that there are two kinds of ego defenses. The first one are immature ego defensive, in which there will be more problems when you resolve that conflict, and the other ones are the mature ego defenses. So guys, now the important thing about ego defenses is that they get mixed up a lot. So we'll try to clear them as much as possible as we can during this session. Okay. So the first one is acting out. So what does acting out mean? So acting out means whenever you have an stressor or an emotional conflict, so we don't we use actions rather than reflecting our feeling, right? So how can they test you this in exam? So they can give you a question that a person uh, okay, so they can give you an example that a person had a fight, so a person's boss scolds him a lot, and after getting scolded by the boss, he does not tell the boss what is happening to him, why he's so upset or what the boss did wrong, but instead of that he starts to not perform good in order to give bad results to his boss. So this would be an example of acting out. And the second one is denial. So denial means a patient skips a therapy after the therapist to discuss something with the patient that was related to his past. So whenever this thing comes and the patient start to skip the appointment, instead of dealing with his past or telling the therapist that this was something that he did not want to hear, this would be an example of acting out, right? So the second thing is denial. So denial means that the patient is avoiding some painful reality. He's not accepting something, right? So what could be an example of this? So an example of this would be the patient is not accepting. So a patient was diagnosed with stage 4 colorectal cancer, and after being diagnosed with stage 4 colorectal cancer, the patient is still going every day to the job and he's not going to the doctor, right? So what is this thing? So this is a classical case of denial. So what is happening is that the patient knows that he's having a serious problem, but his brain has found a way to deal with the problem by ignoring the reality of the problem. So this would be denial, right? Another thing is that so another example of denial could be that a person who is preparing for USMLE step 1 has mm, has failed step 1 or step 2 3 or 4 times, but he's still preparing for step 2 and he's in denial of whatever has happened to him, right? So this is another example of denial, right? So now we move on to the third one, which is displacement. So displacement, so we need to see two things. The first one is displacement and the second one is projection. So what is displacement? So displacement is a very simple thing. So displacement means if I am scolded by someone or if I am being tortured by someone, so instead of telling that person or getting back to that person, I I decide to do that same thing with another person. That would be an example of displacement, right? So for example, if today I had a fight, so this is a very common thing which you have heard a lot, that in our childhood our parents used to say, or a lot of people used to say, that if a teacher had a fight in morning with his wife, then he would scold the students. Or they can even give you in this exam, give this thing in exam. They can say that a teacher came, and after coming uh, um, to the home, he had a fight with his wife. And after with the fight with his wife, he decided to take or conduct vivas or exams the next day, and he intentionally failed three or four children, students. What is this an example of? This would be an example of displacement, right? Right. So what is projection? So displacement and projection are two things which get confused a lot. So projection means that you are having some problem, and instead of accepting that problem, you just say that the other person is the one who is trying to do this thing. Okay. So if you want to eat out, so for example, you are on a diet and you are avoiding all kinds of pizza and burgers and fast food, but all of a sudden you want to do a diet, you want to eat a pizza or a burger. So in this kind of immature defense mechanism, what will happen is that you will say that the person sitting right next to you wants to eat a pizza, and because of that I'm going to order a pizza, and you put all the blame on that person. So that would be an example of projection. So let us go over some examples of projection as well as some examples of displacement, because these will come a lot in exams, right? So another example of projection is that, for example, a male wants to sexually abuse a female colleague of. So they can give you a case that a 25-year-old, a 30-year-old male came, and that male wants to sexually abuse or harass a female, right? So so he went to his boss, or he went to the HR department, and he told his HR department that the female wants to sexually harass me or sexually abuse me, and she has given me a few hints about her, and he reports that female. So that would be an example of projection, right? And so what would be an example of displacement in this case is that, for example, a male so a male gets, okay, so first now let us compare this thing with some other examples. Okay. So now the third thing is this dissociation. So what does dissociation means? So dissociation is very simple. It means whenever you are having a stressor, you drastically dissociate yourself with the reality. And this is a very common thing. For example, whenever if a patient comes and a patient has a death of his father or his mother, then at that point the person will completely shift his personality. He will forget a lot of things, a lot of his motor behavior will change, he won't be able to do a lot of things. So this is an example of dissociation, and we'll go over three specific subtypes of dissociation in our next session. But this is the one thing that you need to remember. And so what could be the examples of dissociation? So a classical example of dissociation could be that a person is a very nervous test taker, and when he went to the exam hall and he saw a question that he did not know anything about, so this was obviously a very big stress about him, and the person suddenly forgets all kind of memories or all kinds of things that he had prepared for the exam. So then they can ask you, what is this defense mechanism known as? So this defense mechanism is known as dissociation. At the same time, for example, there was a robber or there was a person who murdered someone's father or the patient's father, and that person is in front of the patient, is in front of that person now. So they can, and now the person suddenly just runs away, or he's stone cold, he's not saying anything. That again is an example of dissociation, another example of dissociation. For example, a person's father has died or the person's mother has died, and now the patient is just not saying anything. So again, this is an example of dissociation as well, right? So this is an example of dissociation. So an important distinction regarding dissociation is that in dissociation you have no memory of the event, or you have an incomplete recall of the event, right? This is known as dissociative amnesia, right? So another way they can test you is that they can give you a question that the patient had some kind of a recent stressor, and after stressor, now the patient has no memory of that event. So what is this characteristic of? So this would be a characteristic of dissociative amnesia. Okay. Okay. So does anyone has any question till now? Anyone?
Yes, please, can you throw a little light on acting out? I do not really get it.
Okay. So let me tell you once again what acting out means, right? Okay. So acting out means that you are having a problem with someone, right? So for example, I'm your teacher and you're my student, and
Okay.
I say in front of everyone that you right, and you do not deserve to be a student, you do not deserve to take step one or something like that. So now the obvious course of action would be that you say to me that this was very unfair to me and you should not do this to me. But instead of doing that, what you do is you start skipping the classes. You get at me by saying I don't want to take this person's class anymore. This person is not good and I'm not taking any of his class. So this would be an example of acting out. So in acting out, you do not use your fear. So you do not use your conversational skills, but instead you use your actions to get at some person, right? So for example, if there is a person, so if at a place a manager deals with you in a very bad place, in a very bad manner, the food is not good, and when you ask the patient that the food is not good, and we want a refund, or don't, the food is not good for us. Wait a second. Now you say to the manager that I do
Okay,
not
I
like
get
this.
it, but your voice is breaking, but I think I've
Yeah.
gotten it. Thank you. With the first example. Yeah, thank you.
Your voice is
Wait a
breaking
second.
too much.
Mm,
Okay,
mm.
let me switch my network. Wait a second. Okay, guys. So can you hear me now?
Yes.
Yes.
Okay. Is the voice clear?
Yes.
Mhm. Okay. So now we have covered till the acting out part, right? And now we'll move on to the next one.
Sir,
Okay.
I had a
So
doubt.
now, yes, 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 yes.
Sir, in dissociation, you said that you gave an example that a patient's father or mother died and he is in emotional distress. But I don't think so. There would be any memory loss or incomplete memory of that event. So, how could that be a example of dissociation?
No. So see, there are two kinds of. So there are two kinds of stresses response to that stressor, right? So the one thing is that the patient had. So I say, take on. Okay, so let me go here. Let me make it. Okay. There are two kinds of reactions, right? One is that the patient is sad. So they can give you this thing and they can ask you problem with the patient. So in this case, there is no problem with the patient. This is a normal reaction, right? But
Yes.
what if or her mother or father, the patient just stands still and he refuses to do anything. He says, I won't arrange the funeral, I won't do anything, I'm just sitting here, and he's just sitting in the corner, and he's just stone cold and he's just numb. In that case, that would be an example of dissociation. And remember, it's not necessary that in dissociation there will be an amnesia. In like 80 to 90. So one more important thing about USMDs, I know that in most of the cases there are typical signs and symptoms, but remember that you cannot always judge a thing by the case would be absent as well, right? So in those cases, you have to look at the other
Sorry,
things. For example,
excuse
if you
me,
go
Dr.
with
Moaz.
rubella,
Your
so
your screen is not being
Screen
shared,
has
and
not been shared.
your mic is cracking. Your voice is
and can you see
cracking.
my screen?
And the screen
Yeah.
is
We
there.
can
No,
No, no.
can see your screen, and your voice is
Uh,
cracking.
Can see.
We can see your screen, sir, and your voice is continuously breaking. So we are missing what you're saying.
okay, can you see my screen now?
Yes,
Yeah.
yes. Yes.
Okay,
But voice is
okay, now
cracking.
is it cracking still?
No.
Okay, okay. Okay, so this was till the fixation. I think all of the problems you would have been fixed now. So let's move on to fixation. So what is fixation and what is regression? Now we'll do this in the other way. So what is fixation and what is regression? So one thing is fixation and the other thing is regression.
I think fixation, I will stick with the present, and regression, I will go back to the past. I will
Go back to what?
regress with my feelings to the past, or
Okay, so there are two things. The one
Going
is
back to
regression and the
childhood
other one.
days. Regression.
So fixation.
Regret.
So fixation means that you still have some kind of childish activity, right? So you are stuck at a childish activity, right? So there is some childish activity, and you are stuck at that childish activity, and you're not moving forward with that childish activity. For example, someone sucks his thumb whenever there is an exam, and he still sucks his thumb whenever there is an exam. So this is an example of fixation, because you are at a childish activity and you are staying at that childish activity. There is nothing new in this case. Okay, so that would be an example of fixation. So how do we differentiate it with regression? So what happens in regression is that in regression there is a childish activity that was not present before, and now an acute stressor came. For example, now the patient has a death of someone, and the patient goes back to the old habits. So that would be an example of regression. So can anyone repeat just what I have just said?
Yes, so you said fixation you're stuck at the childish activity. That means you've been doing that. There's no changes. Like for example, sucking your thumb during examination or something, right? We've always been
Yes.
doing that. So that's fixation. But for regression, it was not really there, but a stressful activity happened. Then you went back to it. For example,
Yeah. Okay.
yes.
So now, what are the common examples of fixation? We do it a lot, right? So a lot of people bite their nails, right? A lot of people bite their nails. This is a characteristic and classical example of fixation. They can ask you this in exam. If the person is having an exam, and whenever the patient has exams, he starts to bite his nails, right? Or he chews on a pen. A lot of us chew on a pen. I've seen people just eat their Apple pencils away whenever whenever they were stressed. It is present from the childhood and it's not going away. Whereas in regression, that activity went away and now the patient does not have that activity anymore. But all of a sudden it came back. So this is regression and that was fixation. In fixation, there was no cure for that thing, but in regression, there was a cure and it is not present anymore. So now again, two more things. So first one is idealization. And the second one is identification. So always remember the differences between the conflicting ones. So like idealization and identification, these are the ones that get confused a lot. Regression and fixation as well. They get confused a lot as well. So what is idealization? So in idealization, what happens is that so in idealization, there are so what are the patients in which idealization is present? So idealization is normally present in patients who have some kind of personality disorders, okay? Especially dependent personality disorders. So you will see this condition with those people who have a dependent personality disorder. So there will be dependency in this patient. And what they will see is that so for example they can give you an example that a 29-year-old female comes to you and the female had past 6 relationships with different boyfriends and now she has moved on to the seventh one. Okay. And during the past 6 relationships with the boyfriend, all of them ended in a very bad way. And she says bad things about all of these 6 boyfriends. But now she has moved on to a new seventh boyfriend and she's very happy about the seventh boyfriend. And she says that this person is flawless. So this is the thing they will give you an example. They will say the patient is flawless and the patient does not have any problem. So he's flawless, there is no problem, and I could not have found a better person than this one. So try to imagine someone around you with this kind of trait, and this will become very easy for you, right? So in idealization, you will say that this person is the best, and there is no one better than this person, and there is no problem with that person. So this is an example of idealization. So now, or you could say that my new tutor is the best. There is nothing wrong with this person. He is the best. I just want to study from him and I do not want to change anything. But all of a sudden, after 10 or 15 days, you just say, I don't want to study with this person anymore. He's the worst. Now I'm going to find someone else. And when the person finds someone new, he'll do the same pattern and again and again. So this is an example of dependency, or it is a dependent personality disorder, which is present in a lot of people. And in dependent personality disorder, the first comorbid that we studied is idealization. What is the other one that is present? So we'll go after with that one too. So it's splitting. So splitting is present in dependent personality disorders as well. But right now we are focusing on idealization, and now we'll focus on the second one, which is identification. So what is identification? So identification is present in patients who have anxiety disorders, who's always anxious. He has some kind of anxiety disorder. So identification is present in those people who have anxiety disorders. So what happens in identification is that you will start to mimic the traits of another person. Whether those traits are good or bad, that does not matter. But what you will do is you will start to mimic the trait of another person. Remember, they can ask you in which people is this disorder most prevalent. So those people who have a problem with anxiety will have this disorder identification. So what you will do is that you will just start to copy all of those actions of someone. For example, what you could do is, uh, for example, I can tell you, this happens a lot in a lot of households as well. So, for example, if a father is abusive and he abused his boy, so obviously the boy was abused, he would have some kind of anxiety. So, now what does the boy do? He gets, he becomes a parent, and now he starts to abuse his baby boy as well. So this is a classical example of identification. They can give you this exact scenario, or they could ask you other scenarios. Another one that they could ask is a patient. So, for example, you have an attending, or you are going on a rotation with a new attending, and you went on to the rotation, and that attending had a white coat, and in the white coat he always had a pen in the coat. So what you do is you buy a white coat as well, and you buy the same pen like that of attending, and you start doing the exact same thing. So that is an exact example of identification. So basically you exactly start to mimic that thing which was already present in uh, uh, that patient, right? So this is how identification occurs. Do you want me to give more examples on this as well?
So what do you mean by
Sir, I have a question.
Keep one by
so what
one.
do you mean dependency in idealization?
Okay, so dependency is another problem. Idealization is another. But whenever a patient is dependent, he will have mostly have uh, idealization as well. Okay, so what is dependency? So dependency is simple. Dependency means that you are always dependent on someone. You're always in need of another person. Okay, so they can give you an example that there was a person, and that person. Okay, so there is a person, and he had one girlfriend, and after the breakup he just went on to another girlfriend, and he always stays with his mom, and he cannot stay alone. So this will be a classical example of dependency, right? So this is what we mean by dependency. Regarding identification, another example they could ask you is that we could say I could say that a 14-year-old male boy comes to you, and that boy's father was in army, right? And he has heard a lot of stories about his father, and he's really proud of his father. So now what happens is, the boy does not feel scared anymore, and he's very brave. What is this an example of? So this is an example of identification. So he's identifying himself like his father. So identification is very simple. In identification, you raise yourself. So you raise your identity, and you adopt the identity of the person you want to adopt it. Right? So a lot of patients who went goes to go to the therapist, so they will be in anxiety. So anxieties are a very strong risk factor for identification. So a lot of people who go to their therapist, who go to their psychologist, they will start to behave in an exactly same way like their therapist, right? So this will be an example of identification. And another thing that is important is that a lot of young females, this is a common problem, a lot of young females are emotionally very dependent. So a lot of young females have dependency disorder. So what happens is that these females always need someone by their side, right? So if their parents are ignoring that female, so that female will obviously need someone else. So in that case, if they go into a relationship to fulfill their dependency problems, they will adopt the idea of idolization. So they will say that they're, so remember, the people who are independent personality disorder get abused a lot, right? And why do they get abused a lot? Because they have the issue of idolization. So they are dependent on a female, and they're dependent on a male, and they idealize that male as the best human being or as the best boyfriend ever, and they ignore all of their flaws. So if the boyfriend abuses that female, gets money from that female, physically abuses that female would be okay with that, because this is a characteristic case of idolization, and in her brain that boy is the perfect boy from him, and the patient could not have anything better than that one. Okay. Okay. So now let's move on to the next one, which is intellectualization. So intellectualization is very simple. So in
Sir,
yes,
splitting is seen in borderline personality disorder.
yeah. What are you saying? Can you repeat yourself?
I say splitting is seen in borderline personality disorder.
Yes, splitting is seen as borderline personality disorder, which is somewhat different, and we'll get into as well. So what happens in intellectualization is whenever there is some stress, you use your mathematical, abstract, rational, logical reasoning to get away from that stress. Okay, so this happens in stress. So whenever there is stress, you start to intellectualize, right? Very simple example. You have invested in cryptocurrency. Okay, for or let's make it more simple for you. So so you are preparing for step one, okay? And a tutor comes to you and he says, give me $15,000 and I would prepare you very well, right? You give $15,000 to that tutor and he just runs away, he blocks you. So this is an emotional scene for you. So this is a very stressful situation. So instead of accepting this problem, you say, "Oh, it was only $15,000. Once I become an attending in US, I'll just make $15,000 in the matter of 4 or 5 days. So this is not a very big problem for me, right?" So this is you doing intellectualization, or this is someone doing intellectualization. So this is how intellectualization may present. Another thing is that, for example, a patient is having oh, okay, so another thing is that a patient is having a severe cancer. So the patient is having a colorectal cancer or stage 4 breast cancer, and this patient comes and say, so instead of accepting and going for the treatment, the patient says, no, let us contrast here again. So instead of accepting that the patient is having a cancer, the patient says, oh my god, this is just some cells which are cell dividing rapidly. This is nothing else. He goes to everyone, he says, these are just cells which are dividing very rapidly. So these are just some abnormal cells. What can a cancer do to me? There is nothing else behind this. And there will be some treatment and I will be all right. And those dividing cells will be targeted by this inhibitor and that inhibitor and tyrosine kinase inhibitor. I would say I would take a trastuzumab. I could take an anti-estrogen treatment because this cancer depends on estrogen. So if I take anti-estrogen treatment, I will be perfectly all right. So he's using every, or that female is using every kind of rationale, every kind of intellectualization to deal with this problem. right? So that is how intellectualization occurs. So another important thing here, okay, so now this is one case of a cancer. So they like to test the cancer scenarios a lot in in psychiatry, especially in defense mechanisms. So they can give you another example of a patient who had stage 4 breast cancer, and he just he just does not go to the chemotherapy. He says, "Oh, I'm too busy for chemotherapy. I'll go to the chemotherapy the next day." So, what will be this be an example of? This would be an example of denial because the patient is not accepting it. And the third thing, which is an mature defense mechanism, is the patient is having an emotional or stressful response, and now the patient starts. So patient say, I'm having breast cancer. I will, I'm very rich. I will order a breast prevention examination for every female of age 40. Breast prevention. So I'm using my wealth onto this thing. So this is an example of altruism, which is a mature defense mechanism, and it's very good. So the mature defense mechanisms are good. Now, there's another thing which is very similar to intellectualization, which is rationalization. So, rationalization, it's very simple. In rationalization, you use excuses or explanations to justify your behavior, attitudes, or belief, and to avoid self-blame. So, what do you think this way? What are the things in which this thing is common? So, this thing is common in obsessive compulsive personality disorder. How so? So, for example, what do the patients of obsessive compulsive personality disorder do? Anyone?
They want the surroundings clean and perfect
Yes.
in a
So,
defined order.
yes. So they want
They
everything in a
repeat
defined
they
order.
repeat action.
Yes. So
Repetition.
they repeat it. So if you go to those patients and you ask those patients, why are you doing this thing? Why are you cleaning this over and over again? They will find some kind of excuse to prove you wrong, to put the blame on you and get out of that self blame, right? So they would say that that when after so there is a study that after you wash your hands and go out of the washroom or the restroom, there are more than a million bacteria on your hands again. So they'll say there are more than a million bacteria on your hands just after you go out of your restroom. So I'm washing my hands again. Or uh, cleanliness is very good for the brain. That is why I'm doing it. Or I need these things in order because what if I need any of these things in the case of an emergency and I won't be able to find it. So they will always find some kind of excuse to justify their behaviors. So whenever a patient has any kind of excuse to justify their behavior, this will be an example of nationalization. Okay. For example, you could say that my professor failed me in my final Viva exam because the patient did not like me, but in reality the patient hadn't had studied the whole year. So the patient so if a person did not study the whole year and now he's saying that I got failed because my professors did not like me or they specifically made the things bad for me, that would be an example of rationalization. Or the patient can say, I have a very bad luck, whole of the exam came from only those topics which I had did not study. I have the worst luck in this world. Again, this is an example of rationalization. Okay. So now let's move on to isolation of effect. Okay. So isolation of effect is very simple. So isolation of effect means um isolation of effect occurs again in time of some kind of a trauma, right? So isolation of effect occurs in a trauma. So in isolation of effect, you just so see, whenever there is a event, there are two parts to an event: the physical part and the emotional part. And these two are interconnected. The physical part cannot happen without the emotional part, and the emotional part cannot happen without the physical part. For example, you love a girl very much, or a girl loves a boy very much, and the girl proposes to the boy, and the boy rejects. This is the physical thing. There is an emotional part as well. The emotions of that girl would be disturbed as well. But in isolation of effect, What happens is that you accept the physical part, but you do not accept the emotional part. So it's very similar to denial, but in denial, there are two parts. The one would be physical and the other would be emotional. In denial, you do not accept both of these. You said this thing does not even exist. This is not existing. But in isolation of affect, you do not accept the emotional part. For example, a girl, I had already told you, a boy proposed a girl and the girl rejected. So the boy goes to his friends and say, the girl rejected. I'm completely normal. It's not possible for anyone to be normal. Or a murder happened in front of a person, and that person comes and say, oh, there was a murder and the murder happened in front of me, and there were two guys and the patient is completely normal. This is again a defense mechanism in which your brain, all of this is happening at the level of brain. The brain does not accept the emotional response. Okay. So now there's passive aggression. So what is passive aggression? So passive aggression is very simple. In case of a passive aggressive disorder, you okay. So this is common in people with bipolar. So in bipolar disorders, two things are common. We'll study two both of them right now. So one is splitting and the other one is passive aggression. So what is passive aggression? So passive aggression means you do not show the aggression directly. You show the aggression indirectly. Okay. So this is an example of passive aggression. Okay. So for example, your boss comes to you and your boss says that your work is not up to the mark, and you get very offended by his comments. So now instead of talking, okay. So there are two things. So now you will get it confused with acting out. So that is the problem here. These two get confused a lot. Okay, so one is acting out and the other one is passive aggression. So let me give you very clear examples of this so it becomes very clear. Okay. Okay. So in acting out, remember there are direct actions. Okay. But in passive aggression, there are indirect actions. I'm telling you these again and again because in the exam, whenever there is the word of passive aggression, there would be the word of acting out as well. They will love to test you on this. So, and acting out is direct. So, make this difference between them. Acting out would be very visible, they will be very impulsive, and there will be direct actions. But passive aggression would be very sneaky, it would be behind their backs. Okay. For example, okay, so let me give you an example. So a boy had a fight with his parents, and just after the fight ended, the boy slammed the door in the face of his mother and father. This is a direct thing which is occurring at the level of their parents. So remember, there is no conversation. So in order to qualify for acting out, there should be no conversation. So the boy did not have any conversation regarding his feelings, but now he had a direct action in which he slammed the door directly at the patient's face, at the parent's face. Okay. What is passive aggression? So passive aggression means that, for example, the same baby had an accident, had a quarrel or fight with his parents, and now instead of doing something directly, what he does is that he pulls the plug of the freezer without them knowing. So everything that is present in the freezer gets spoiled and nobody knows what is happening, right? Or he starts not doing his own work, right? Or he starts saying bad things about his mother and father to the relatives, okay? Or he starts stealing, okay? Okay. Another example of passive aggression that I can give you. For example, you and your friend had a plan. They love to test this example. So you and your friend had a plan of going to the northern areas or going to some kind of hilly areas or a vacation ski resort. and your friend said that, sorry, I cannot go with you. I have some urgent task at my home, so the plan is cancelled. So instead of asking the friend that I'm telling the friend, so remember, no conversation. There is no conversation now. So instead of saying that I'm very feeling very bad, you just say, oh, it's fine. I really don't want to go there anyway. That place is really bad. Or you can say, who would want to go with you at such a place? You're not even worth it. So instead of dealing with the problem, you are showing some kind of aggression in a passive way. So remember, it's not direct, it's indirect. But if I want to make it to the acting out part, so I can say that both of you are in the car and you ask your friend to stop the car right now and just slam the door and leave the car and say, I can go home on my foot, or I can take an Uber, or I can get a lift and I can go home. So that would be an example of acting out. I'm telling you, I told you this in very detail because this one gets little uh, a lot. Okay. So next one is splitting. So splitting also occurs a lot. In borderline personality disorder, BPD. So passive aggression was the one, and the other one was splitting. So in bipolar disorder, splitting occurs as well. So what happens in splitting is that a patient, so the patient of splitting cannot integrate a positive or negative thing about anyone into a same picture. Okay, so they cannot say that a person is so because every person has some good things and some bad things. Okay, so they cannot accept this thing that so if this is a person in someone's brain, he will have some good things, he will have some bad things. If the patient, so normally you accept both of these things, right? But the patients of splitting have all or none view about something. Either they can accept that the person is good, or they can accept that the person is bad. They cannot accept both of these things at the same time, right? Let me give you a very good example of this. So the patients of splitting will say, and guys, these disorders are very common in our world right now because we are going through such a digital age in which the psychological disorders or the psychiatric disorders have doubled or tripled down. So you will see a lot of these examples in real life. So try to find as much examples as you can and relate yourself. Okay, so what I can say is that uh, the person. So for example, there is a boy, and the boy says all teachers are bad. All teachers are bad because he saw that one teacher was bad. So now the patient, the person of splitting, cannot accept that some teachers will be good and some teachers will be bad. He will say every teacher will be bad. So now, if even his mother is a teacher, he will hate his mother. He'll say, my mother is also bad because he is a teacher. He cannot separate, his brain cannot separate this thing that some teachers can be good too, right? Also, or for example, uh, a person had a very bad encounter with the police, and the police did not help that person. Now, the person will say every policeman in the country or the world is very bad. And if he encounters any, so for example, if you're a doctor and you had an encounter with a policeman and that encounter was not good, okay. So now you say every policeman is bad, and if a policeman comes to you for treatment, you do not treat that patient. You say every policeman is bad, I won't treat it. Right? So this is an example of splitting. Splitting again occurs in borderline personality disorder. Or you can
Is
say, yes,
sorry, Doc, is this like generalization?
generalization. Right, exactly. It's generalization because you cannot tolerate ambiguity. Remember, in everything in this world, there will be ambiguity, especially in psychiatric disorders. You have to accept that their ambiguity exists, but the person cannot make this thing exist, right? Okay. So that is the thing. You cannot accept that there is ambiguity in this case. So you generalize everything to everyone. Okay. So you see one thing, you generalize it to every effect of the faction. Okay. Now we'll move on to, so projection was done, rationalization was done, reaction formation was done. Okay, so let's move on to reaction formation. Okay, so what happens in reaction formation is that you, so for example, you have an impulse. So we have seen in denial that you cannot accept it, right? In denial, you cannot accept it. So if there was a case of denial, you could have not accepted this thing. But in case of reaction formation, you have an impulse and you start to do exactly in the opposite way of that impulse, right? So for example, you want to eat fast food. This is your impulse. So you go directly in the opposite way and you do not eat anything at all. This is reaction formation. Or you are a person who is homosexual. So now you start uh, disliking every homosexual person. Instead, but in reality, you like homosexual people. But since this person is going through reaction formation, he starts disliking all of those homosexual people. Right? So this is reaction formation. Okay. So they can give you an example of this, like that the leader of a cult organization actually wants to kill the whole world. But now he suddenly says that everyone else who is killing the world is a bad person and I want to save the world. But in reality, he wants to kill the world. This would be an example of reaction formation. Now, the final one is repression in the immature defense mechanism. Okay, so we have to differentiate repression with suppression. So, what happens in repression is that you suddenly, the thoughts that come in your mind are automatically removed from your mind. Okay, they become absent from your memory. Whereas in suppression, you consciously inhibit those things. Okay, did you get my point?
No, sorry, please come again.
Yeah.
Oh,
Repeat,
okay,
please.
okay, okay. So remember, okay. So this is a very strong psychiatric potential as well. Both of these things we need to cover it really well. This is really interesting as well. So in repression, what is happening is that you had a thought in your mind. For example, you have your step exams after 7 day, or you have a step exam after 10 day, but you start watching a movie and that thought of step exam goes away from your mind. This is repression. Okay, right? So this is repression. So this in this thing, what is happening is that your brain is repressing the stressful situation all of a sudden without you being knowing about it. So this would be repression. So, but if I say that you are having a step exam after 10 days and you consciously say your brain to not worry about the situation and to make your brain aware that it is just a normal exam, and your brain then stops thinking about it, then it would be an example of suppression. So suppression means you are consciously inhibiting that thing. So now, what are the other ways this comes? Let me give you more examples so you can remember this thing. Okay. So most of us have fears in this world, right? So most of us have fears. So I say a boy is having a fear of swimming. Okay. So I say, so now we'll tie it to classical conditioning as well. Okay. So I am saying you are that a boy is having a fear of swimming. Whenever he goes to the water, he's very scared of the water. And you know what was the main reason that the boy was scared of water? Because he had a drowning accident in the childhood. The patient drowned in childhood. So that is why the patient is having a fear now. But what the brain did was remove that thought from the person's brain. So the patient does not know anymore that that I had a drowning accident in the childhood. But he, for some reason, is very scared of swimming now. He does not know why, but he is very scared of swimming now. This is a thing which happens to a lot of us in different ways throughout our lives. There was something that happened in our childhood. So this is known as a childhood trauma. So there are a lot of childhood traumas that are present with us and we come classically conditioned to those childhood traumas. For example, for example, in for a patient was very obese in the childhood. He was very obese and everyone mocked that child due to obesity, which is known as childhood obesity bullying. So every person in bullied that boy. So now the boy has forgotten that everyone bullied him, but one thing will stay with that boy. So when he forgets that he was obese, that means the brain has repressed this thought. But one thing will remain back in his mind, that I cannot get obese again because becoming obese is very bad. So this is a very strong fear of this boy, which is happening. So this is repression. What is suppression? So if we make suppression with the same thing, we can say the patient drowned in childhood and he remembers that I have drowned. But now he says it is completely okay to drown. A lot of people have drowned, but now I have completely learned swimming. I have swimming safety as well. There are swimming instructors with me right now. The pool is not that deep. I have a life jacket as well. There are guards as well as who can save me as well. So I do not need to worry about the drowning incident anymore. So that would be suppression. Or, for example, the patient says that I was obese in childhood and the people I lived with or the people I shared my class with were not very good. They were very bad people, and my teachers were not supportive of me as well. But I think at this new place, everyone is supporting me. So, being obese is not a problem anymore in terms of social standpoint. So now I am completely okay with being obese, with that social aspect, right? So this is an example of suppression. So did you guys get it now?
Would this be suppression or would this be sublimation?
No, sublimation is something else. We are now going to sublimation. Okay, let me tell you what is sublimation. Okay, so sublimation is very simple. Let me tell you about sublimation. So now we are coming on to the mature mechanisms. So sublimations means that someone is demanding something from you. Okay, so a person is demanding. So a person is demanding something which is unattainable or is unacceptable. You cannot do that thing, right? For example, let me give you an good example of sublimation. Let me think the one which will make things very clear for you. Hmm. Okay, so for example, mm, okay, so let me tell you an example of sublimation. So for example, you guys ask me that you guys need to study at 8 p.m. EST. But maybe that is not possible for me. Okay. So this thing is not possible for me. So what I do is that instead of saying that I cannot do it, I suggest an alternative plan. So I say, guys, I won't be able at 8 p.m. EST. I'm available at 7 p.m. EST. and you guys say no, we only want to study at 8 p.m., which is unacceptable, or which is not attainable for me. This is an unattainable thing for me to make you to tutor you at 8 p.m., because maybe I'm busy at that time. So what I do is that I record a lecture for you at 7 p.m. EST, and that lecture is being played at 8 p.m. So I am shifting your focus from an unacceptable or unattainable impulse toward a goal directed activity. So this is a goal directed activity. This is possible. I can record the lecture at 7 and then give it to you at 8. Right? So again, the second thing is, for example, which happens a lot, is that a boy a boy proposed to a female girl, and that female rejected that boy. He say, I'm not okay, so I do not want to do anything with you. And the boy is really frustrated, and he's really angry, and he's really sad. So instead of just sitting there, he takes his anger and he starts going to the gym, or he starts studying well for some exams. He clears some entrance exams. He starts going for the steps. He starts going for the diplomatic exams, or something like that, and he becomes a very good officer, or he becomes a very good doctor. So that again would be an example of sublimation. Okay. So the final one is humor. So what happens in humor is that, so another example that I can give you, for example, uh, uh, the parents want a child to become a doctor, but the child does not want to become a doctor. He wants to become, so now the child understands. So the parents want child to become a doctor, not due to any goal, just due to the prestige. So the boy understands this, and the boy say to the patient, to his father and mother, that I understand that you want me to become a doctor, so I am successful, but I am giving you an alternative plan. Let me become an engineer. I would be a very good engineer, and you would have the same perks of being a highly qualified engineer as that of a doctor. So that would be almost same. So the child is replacing an unattainable desire, or a desire which the child does not want, with the desire that is very good, and that he can attain it easily. So that would be sublimation. The final one would be humor. So in humor you just use, so we have to separate humor with acting out as well. Remember, guys, these are very interconnected, all of these. So in acting out, can anyone tell me what two things are told in acting out?
It's direct. It's going to be a direct action
And
No
and no
conversation.
no,
conversations.
no conversation, right? Why is there no conversation? Because the person cannot tell his feelings or his thoughts to the other person. So this is immature way. So what is a mature way? You can use humor. So what happens in humor is that the person uses comedy to do the conversation, and then he would tell the person about that problem or that emotional feeling, right? For example, in acting out, I told you that, for example, the boss scolded a person regarding his bad ethics or bad manners, or he's not doing a proper performance. So one thing is that he can slam the door on his face, or he can just stop coming to the work. Okay. Or he can say to the boss in a humorous way that, I don't know what else I want to do. Boss, do you want a Rolls Royce, or do you want a car from me? Because I don't think any other thing is working in a way, or he can make any joke about the situation and diffuse the situation. And at the same time, in the joke, he can tell his emotional feelings to the other person as well. So this would be an example of humor. Another one, which is not mentioned in the first state, is anticipation. This is very simple. So anticipation means you do future planning without worrying about the future discomforts, right? So you know that tomorrow we are going to study the next 4 or 5 pages of the psychiatry. So now you see all of those pages, so you know a bit about what we are going to study and what can come in the exam. So this would be an example of anticipation. Okay. Okay, so I think we'll keep it to this here. And the next time, I think, okay. So let us go to the grief as well. Let us touch grief as well. So what is grief? I've already told you that when someone dies, there will be sadness, there will be emotional stressors, and symptoms will vary, but there will be some symptoms. The patient will feel guilt, sadness, and some things as well. Okay, so remember one thing. When someone dies, there can be hallucinations of this patient. Okay. Okay. So there can be hallucinations, or they can say, I wish I was dead in place of that person. Wishing they were dead. So this is a normal thing. Remember, they will give you this question in exam. They will say a patient's father died, and now the patient is saying, I can see my father. He's sitting on the chair. He's just sitting there. I can see the patient. And they can ask you, what is this diagnosis? So that won't be a diagnosis of schizophrenia. That won't be a diagnosis of psychosis. That won't be a diagnosis of major depressive disorder. Or the patient said that I wish I was dead in front of my father. That would be a normal grief reaction. But if this grief reaction lasts more than 6 months, or it fulfills the criteria for MDD. So for MDD, there is a criteria of psychic apps that will study, or it impairs the normal functioning of the patient. For example, after the death of the patient, 6 months have passed, 3 months have passed, and the patient is not enjoying anything, he's not eating anything, he's not doing anything, then that would be an example of prolonged grief disorder, which is a disturbing condition and that needs to be treated. But if the patient is having normal symptoms and normal hallucinations and he's just wishing he was dead, this is a normal thing and you guys don't need to worry about it. Okay. Now, regarding the infant and child development, I don't think so. That's really important, and you can skip this table from the first chair, right? Physical, sexual, emotional abuse, again, they are not important. Child neglect and vulnerable child syndrome are not important. So we have covered till childhood and early onset, childhood and early onset disorders. Today, tomorrow we'll do the childhood and early onset disorders and onwards, and that topic is really important, right? So, does anyone has any question?
Can I ask about autism?
What?
Autism. Aut-
Wait, I
uh,
Altruism.
autism. Yes.
Okay, so altruism is very simple. In altruism, whenever there is a stressful situation, you do some kind of a charity event, charity work, and that helps. So you serve others, right? So whenever you serve other, you resolve your own guilty feelings by meeting the need of other people, right? So if a rich woman is present and he gives her lunch to a homeless person, the person will feel good. This will be an example of altruism. So altruism is just like charity.
So can you please explain anticipation again?
Okay, so anticipation is again very simple. In anticipation, the patient already plans for the future, right? So, for example, a person is getting married next year. So he knows when I will get married, I will have children and I will need to tend to those children. So he already knows all of those things and he starts earning more before that. He starts to make his own house, he starts to get a car because whenever there will be a child, the patient will need a car or the person will need a car to get to somewhere. So he already knows all of those things and he knows that I will do all of these things before because all of these things are needed for my child. So I'm doing my future planning. So this future planning is an example of altruism, anticipation.
Okay, sir.
Okay. Okay, so guys, take care. We'll do it now
Okay.
and we'll have the next
Doc.
session. Yes, yes.
Yeah, I have a question. What's the difference between mature and immature defenses? Like, how are you differentiating those two terms, mature defense and immature defenses?
Okay, so remember, first of all, you have to remember what one was the mature one and what were the immature one. Okay. Okay, so the mature ones are the one which will help the person in a constructive way. Because whenever you are doing charity, that will help, right? Whenever
Mm-hmm.
you are diffusing a situation with humor, that would strengthen your bond with your boss. But instead, if you slam the door in his face or if you slam the door in your parents' face, that will weaken your bond with your parents and your boss, and that won't help, right? Again, if you are doing an anticipation for something instead of doing a denial, so anticipation is very much related to denial. So if you have a cancer and you are anticipating that I will need this chemotherapy, and for 7 or 8 months I will need a lot of money and I cannot do my own job because of cancer, so I'm going to start saving some funds right now. This would be an example of anticipation. Versus in denial, you just don't accept it. So denial is not helping you in any way. It is deconstructing you. It is moving you towards more danger and more problems. But again, anticipation is helping you in a better way. Again, in suppression, you will know what's the problem, and you can suppress that problem and move it towards sublimation. So in sublimation, if you have some unacceptable demand, you make yourself happy as well as your parents and the other person by moving towards a demand that was more attainable and everyone gets happy. So mature defense mechanisms will lead to constructive things, less emotional stress, while immature defense mechanisms will lead to psychological distress and it will increase your psychiatric problems, right?
Yes, got it, got it.
Okay. Thank you. The Morris, do you have any question? I don't think so. He's
Yes, sir.
interested.
So I had to ask, isn't humor just another variant of suppression in itself only? Because if we take the example in first aid, if you see a nervous medical student jokes about the board, so isn't it like the nervous medical student is suppressing his fear for the boards by using humor? So is it that suppression is more intentional and more voluntary as compared to humor being sort of like an involuntary response? Is that the difference between humor and suppression?
Okay, so first, let me tell you one thing. Almost all of the defense mechanisms, which are the mature defense mechanisms, they will be voluntarily. They will be conscious things, right?
Yes.
Okay. Okay. So yes, all of those things, you are right. In some way, humor will match the suppression as well, because you are consciously diverting your attention towards another thing. But the means, the only difference between them is the means, right? So in humor, you are using the humor, whereas in suppression, you are using a logical reasoning and your rational thinking to separate yourself from that distressful thing. Okay.
Yes, sir. I understand.
Yeah.
Thank you.
No worries. Okay, guys. So I have to go now, and we'll do start tomorrow. Okay. Bye bye.
So will there be another lecture tomorrow?
Yes. So there will be two more lectures, and we will complete psychiatry in the next two lectures.